All right, what's going to happen? Is the crisis going to get worse? Maybe. Could it be that we're overthinking it, and that as places reopen, if they do it safely, we'll be okay? Maybe. Are we going to see something change at the federal level? Probably not. Well, look, that's the opposite of what Rick Bright was saying today, right? He's saying, look, I know, I was on the inside, and here's what has to happen. As a scientist, now turned whistleblower, those who are in charge don't have the right kind of plan. They're not fighting this the right way. And if they don't get it together this winter, when you have the flu and all this density and people back in school and working in a way that they shouldn't be, you're going to have a really scary winter. How did that resonate? Ranking member of the subcommittee that questioned Bright is Texas Representative Michael Burgess. Congressman, always welcome to see you on Prime Time.
Sure. Great. Thanks for having me on. Good to see you back on TV, and valuable firsthand experience that you've brought the nation, so that's a good thing as well.
Thank you very much, Congressman. I appreciate the good words. What did you take away from the testimony today? First, on a substantive level, anything that you heard that you can act upon?
Chris, there was more heat than light. So the answer to your question is maybe, but maybe not much. But here's the deal. This hearing was premature. Yes, Dr. Bright has filed a whistleblower complaint, and that's important. That's serious. It deserves to be heard. But this is a week into the investigation. It's really unusual to have a full-blown committee hearing on something like this prior to doing any of the investigatory work. So in many ways, we're flying blind on this. We've got Dr. Bright's rather elaborate testimony or letter that he provided through his law firm. So making those allegations, we have no data from the other side. We've got partial email chains. We don't have full email chains. Some of the things that Dr. Bright asserted, I think, sounded plausible. Other things that he asserted, knowing some of the individuals, knowing some of the timeline myself, I found them less than believable. Now, people may just remember things differently, and that's certainly possible. But here's the deal. Democrats wanted Dr. Bright in because they thought it could damage the president. And I don't know whether their mission was accomplished or not. But if the idea was, let's help the country because we are in a bad crisis, I don't think that really moved the needle. And that's what's unfortunate about this.
Agreed. Let's talk about testing. The president keeps saying, I don't know about testing. You know, I don't know. I don't know that it's as important as they think. The only reason that we have so many cases is that we keep testing, and every time you test, you find out something's wrong. You know, they say they need a lot of tests. I don't know how they test. And then he says, well, we have more testing than anywhere in the world, and we have the best testing, and everybody can get a test. Now, you and I both know that every single one of those propositions is false. And I know you're holding back a laugh right now, and I encourage you to hold it back. Don't
laugh. It's a smirk.
And don't smile. But you know how important testing is. Do you think you can get your colleagues on the right to work with people on the left to do anything on the federal level to make testing a priority in this country?
Well, what I do think is we cannot criticize the president on this issue when we were so inert and inactive through February and the first half of March. I had asked our subcommittee on health, we got a bad problem here.
In January, you were saying things.
Well, right, but as far as the testing, that really became a problem in February. I don't know why the CDC got so far behind the curve. I agree with the president. It's the system that he was handed, and there were some decisions that were made at the agency level at the FDA back in 2012 and 2014 that I don't think were well thought through because we were going to drive the private sector out of the laboratory developed testing market. And I thought that would leave us exposed. I didn't know it would leave us exposed on this, but we needed those as a doc. We need those laboratory developed tests. But the FDA said we're going to regulate them like medical devices. That takes forever to get something through. And investment literally dried up on that front. Now, we had the problem, the CDC couldn't deliver. Dr. Hahn wisely at the FDA, I thought, said, I got trouble and I got to allow some emergency use authorizations. So I think it was one of your New York hospitals was one of the first ones around Valentine's Day. He said, look, you can do your own test. And that's the thing, this is an RNA test. Hospitals do this all the time.
Right.
It wasn't that exotic a test.
Right.
So I don't know why the CDC failed on that, but we, as a Congress, could have started asking those questions. And didn't it get anyone's attention that South Korea had done 100,000 tests and we'd done 90? I mean, that's what didn't make any sense to me. So I actually brought it up at a hearing we were having in the middle of February. I got chastised by the now committee chairwoman who said, we got plenty of time for this later on. And we're going to have Secretary Azar in a couple of weeks for the budget hearing, and we got plenty of time to deal with this. Chairman Pallone told me the early part of March, oh yeah, we'll get to it later in the month. And then guess what? We were locked down and we were gone. So we never got to it.
Right.
So
but
now
here's
we've
what
got
I'd
testing,
say.
and we're going to put a lot of money in it. So let's make sure we do it right from this point forward. And we can't just criticize the president. We have to look at ourselves as well.
I'm fine with that. Now, I've been looking down while you've been speaking, completely not out of disrespect. I'm just looking at an entire list of about 15 different statements the president made through February, March, April, and into now, denigrating testing, playing down its importance, telling governors to do it themselves, not fighting for them to get the money to do the same, not helping. And I think he's been against it all along because he believes it will retard efforts to reopen the country because it will be a steady flow of bad information. But we don't have to debate that.
I disagree.
Okay, we agree to disagree on it because it doesn't matter, because it's all about how we go forward. The president just said today, look, I think that this testing is overrated and we just test so much. That's why we have so many cases. That attitude will kill us. I mean that figuratively. You have to do better than that. You have to test more and trace more to deal with what's going to happen in the fall. We still have one company in this entire country making testing materials. It's not enough. What can you guys do to incentivize the president, or on your own, create more manufacturing of what you know you'll need in the fall? The testing equipment to go along to the states, the PPE equipment. What can you do to get that done?
Well, the first thing has actually already happened. It's happened in the second response bill that passed in the middle of March.
But not enough.
Oh, wait a minute. It's well over $75 billion, and there was more added in the last bill that we just did. I don't think they know how to spend all the money right now, and that's another thing that concerns me. We send the money over to the agencies. We don't give them any direction, any guideposts, any guidelines, any guardrails, and then we say we're going to clobber you if you don't do it right because we got 3 investigatory committees that are coming after you.
But isn't that about the executive leadership?
Well, actually, it is about our oversight of, but we should do the hearings. We should do the work ahead of time.
No, hearings take too long, Congressman. We can't wait for you guys to check the agencies. You need the agencies to work with the administration to execute the laws.
We need to collect the data before we advance the money. I mean, that really should be the standard way to do this. And had we started in February, like I thought we should have, we wouldn't be so far behind now. But look, there's some testing mechanisms that are going to be great. There are others that are going to leave something to be desired. A president, I think in what he's seen himself is that some tests are positive, some are negative on the same person within the same day. So he's saying, well, this is maybe unreliable. I get that. I guess I get why there would be that skepticism. Doesn't mean you don't test, and doesn't mean that testing is not important. And as we collect more information with this, as we gain experience with, again, what is a very new disease, I think you'll see the body of evidence accumulate that will be. This is why I don't think the second phase of this, or if there's a second round of this, it will be nearly as devastating as the first, because we will have those tests. They will be available. I agree with your other guest earlier. For heaven's sakes, get the flu shot this fall. Don't run the risk of compounding the problem. I know people say, I don't take the flu shot, but this year take it, okay? And that's going to be an important part of how we arm ourselves against what's coming.
Well, I'll tell you this, Congressman. Look, we always agree. I love having you on the show. It's not about getting into an argument about anything. It's about finding how to move forward in a better way. And that's never been more true than where we are right now. I agree with you about the fall. There really is no reason for us to get hit as hard as we did the first time, because a big reason we got hit so hard the first time is we weren't ready. And if we're not ready this time, shame on us. Congressman, I know you were ahead of the curve on telling people to look out for what was coming. Hopefully they'll listen to you this time.
President did put in a travel ban, which I could never get the previous administration to do with Ebola. So I give him some credit there, because that was important.
Look, there's no question that what he did in China was helpful. Should it also have been done with Europe? Is there everything we should have done with testing? There's plenty of blame to go around, just not the next time. The next time, we can't make the same mistakes we did the first time. Otherwise, it will be exposed for what it is, which is people playing politics. You always have a place here to argue your points, and I welcome you back.
All right, thank you.